The first one, SB 166, updates our statutes related to certified nurse aides, licensed practical nurses, registered nurses, many of you here, I know. And then Senate Bill 169, also by Senator Giesel, really speaks to the importance of immunizations, and both personally and collectively. So I'm going to let Senator Giesel speak to these, but I also want to make sure that we get everybody up here. That's almost everybody here now, I recognize, who had a hand in this or who was interested in it. And I'm going to let Senator Giesel talk about the genesis of these bills and why they're important. And then we'll ask a few of you as well to just bring it down to every Alaskan's benefit from these two bills. So, Senator Giesel, how about if you bring everyone forward?
Great, I would love to. Thank you so much, Governor. So everyone that had a role in Senate Bill 166 and 169, so the Board of Nursing I know is here, the Nurses Association, AARP is here, Division of Public Health, Department of Health and Human Services, if all you folks could come forward. I'll speak first to Senate Bill 166. So this is a housekeeping bill. Might seem like kind of a sleeper, but this has to do with updating the statutes for the Board of Nursing. Governor, I had the privilege of serving on the Board of Nursing for a couple terms, and actually this bill started when I was serving on the board. We have many obsolete statutes, and of course a lot of lawmakers talk about, well, if we're going to pass a new law, we need to get rid of some of the old ones. So that's what we did in this bill. We got rid of some of the old ones, some of the obsolete things that were enacted at statehood that no longer apply. But we also updated some of the advanced practice statutes and some of the titles. So that's why it was important. I'm going to ask Erin Evans, she serves on the Board of Nursing, to step forward and just speak to the importance of the bill to the Board of Nursing. Erin?
Thank you very much. We really appreciate that this bill has gone forward. It makes our job easier as we represent Alaskans and the nurses in Alaska. Having updated statutes, which are current, makes our job much easier. As I understand it, the statutes have not been updated since the mid-90s, so this is very helpful to us. It also addresses the composition of the Board of Nursing, allowing an advanced practice nurse to be on the board, which is very important to us, as well as nurse educators on the board. So this has been very helpful to the job we do. Thank you.
Great. Thanks, Erin. And Pat Center worked very hard on this bill. She represents the Alaska Nurses Association. Pat, would you like to say a couple words about the bill?
Well, the Board of Nursing is the largest regulatory board in the state, covering about 13,000 people that provide health care in Alaska. So it is very important for us to keep these statutes up to date and make sure that the board can have high quality health care providers in the state.
Great. Thanks very much, Pat. So the second bill is Senate Bill 169. Governor, I share your significant concern about health care in our state and access to health care and affordable health care. And that's what Senate Bill 169 is about. When we had Senator Ted Stevens serving in the U.S. Senate, he provided ample funds for a universal vaccine program in Alaska so that Alaskans, all Alaskans, insured and uninsured, had access to vaccines. Well, I didn't think about this, but in 2010, when Senator Stevens left the Senate, we lost that funding. This bill actually began with a citizen, as most good legislation does. This is a former constituent of mine from Eagle River. Her name is Dr. Rosalind Singleton. Dr. Singleton contacted me in 2011, and she said, "Were you aware that we've lost this funding?" Dr. Singleton is a pediatrician as well as an epidemiologist. That's a person that studies diseases, their distribution, and their prevention. So, Dr. Singleton, I'm going to ask you, there she is, I'm going to ask you to step forward and say a few words about the significance of this bill.
Thank you, Senator Giesel. Alaska has one of the lowest immunization coverage rates for children in the U.S. Why should we be concerned about that? Because right now in the U.S., after years of measles being eliminated, we have one of the highest rates of measles cases in the U.S. But in Alaska, we've been free of measles for 20 years. that can change very quickly. This bill increases access to vaccines for all Alaskans and will reduce costs and for providers and for individuals receiving vaccine. And that is important to increase our coverage and prevent outbreaks like measles outbreaks from occurring in our state. And I really applaud Senator Giesel for moving forward with this bill.
Thanks, Roz. So right now, in fact, yesterday, Division of Public Health sent out an alert that we are seeing an increase in influenza. This is an unseasonal time to be seeing influenza, but we're seeing an uptick in it. We need to make sure folks have access to that vaccine. In California, they are seeing an outbreak of whooping cough. This is called otherwise pertussis. It's in one of the vaccines that children get. When infants get pertussis, they are in danger of dying from this disease because of their very small airways, and it's a respiratory disease. We don't want that in Alaska. Having vaccines available will help prevent this. We're seeing an outbreak, as Dr. Singleton said, of measles, particularly in Ohio, but across the U.S. So these diseases are still out there. As a child, I still remember my mother and father having a cloud of grief over themselves when 2 children down the street from us in Fairbanks died of polio. In my lifetime, we have wiped out polio in this hemisphere, in the Western Hemisphere, but it is still evident in the Middle East and Africa, and with the war escalating again there, vaccine is becoming less available there. Polio actually could return to Alaska. So this, Governor, I appreciate your interest in public health and your concern about access to health care. This bill will help increase that. So this was supported by AARP, the community health clinics, the Nurses Association, Commissioner Stewart, Dr. Hurlburt, all worked very hard on it, and I appreciate all the support.
Those of you who are members of the healthcare provider community can see what how good it is to have somebody in the legislature like Senator Giesel, who understands these issues, who's practiced in the same area. That's the beauty of our legislative system, is that it is open to anybody, whether you are a fisherman, a teacher, a recovering lawyer like me, or in the healthcare field. The legislature brings together all these experiences and expertise to serve the people. And Senator Giesel has done a fine job with these 2 bills.